Chlorpheniramine, Aller-Chlor, uses, dosage, and common side effects. Chlorpheniramine is a widely used first-generation antihistamine medication that effectively relieves allergy symptoms. It works by blocking histamine, a substance in your body that causes allergic reactions. This affordable and accessible medication provides relief from common allergic symptoms like sneezing, itching, watery eyes, and runny nose caused by seasonal allergies, hay fever, and the common cold. Its effectiveness and relatively mild side effect profile have made it a popular choice for allergy sufferers worldwide. What is chlorpheniramine? Chlorpheniramine medication is an antihistamine which helps in reducing the effects of the chlorpheniramine, also known as chlorpheniramine maleate, is a first-generation antihistamine medication that belongs to the alkylamine class. It's available in various forms including tablets, extended-release tablets, capsules, and liquid formulations, typically sold under brand names like Chlor-Trimeton and Diabetic Tussin. This antihistamine works by competing with histamine for H1 receptor sites on effector cells, thereby preventing the allergic response in various body systems. Chlorpheniramine has been in clinical use for decades and remains one of the most commonly prescribed antihistamines due to its efficacy and relatively low cost. Unlike newer second-generation antihistamines, it can cross the blood-brain barrier, which explains some of its side effects. What are the benefits and uses of chlorpheniramine? Chlorpheniramine effectively treats a wide range of allergic conditions and provides significant relief from associated symptoms. This versatile medication addresses multiple allergic manifestations throughout the body. Primary uses of chlorpheniramine. Chlorpheniramine is primarily used to treat allergic rhinitis, hay fever, seasonal and perennial allergies, common cold symptoms, urticaria, hives, allergic conjunctivitis, eye allergies, angioedema, swelling beneath the skin, anaphylactic reactions, as adjunctive therapy. Secondary uses of chlorpheniramine. Beyond its primary uses, chlorpheniramine may also be helpful for insect bites and stings, allergic skin reactions, relief from itching associated with chickenpox, as a component in multi-ingredient cold and cough preparations. The medication alleviates symptoms like sneezing, itchy or watery eyes, runny nose, and itchy throat or skin, making it particularly valuable during allergy seasons. How does chlorpheniramine work? Chlorpheniramine functions through a specific mechanism that targets the root cause of allergic symptoms, providing relief by interrupting the allergic response pathway. Chlorpheniramine works primarily by blocking histamine H1 receptors in the body. When allergens enter your body, they trigger the release of histamine, which binds to H1 receptors on various cells. This binding causes the symptoms associated with allergies, such as sneezing, itching, and runny nose. As an inverse agonist of the histamine H1 receptor, chlorpheniramine not only prevents histamine from binding to the receptor but also reduces the receptor's constitutive activity, providing more effective symptom relief. Additionally, chlorpheniramine has anticholinergic effects, blocking acetylcholine receptors. This action helps dry up secretions like runny nose and watery eyes. Unlike newer antihistamines, chlorpheniramine can cross the blood-brain barrier, which explains both its sedative effects and its efficacy for certain conditions. How to take chlorpheniramine? Chlorpheniramine is available in various forms including tablets, capsules, extended-release tablets, chewable tablets, and liquids. The regular capsules, tablets, and liquids should be taken every 4 to 6 hours as needed. Extended-release tablets are typically taken twice a day, in the morning and evening, as required. It's important to adhere to the dosage instructions provided on the prescription label, and consult your doctor if clarification is needed. Chlorpheniramine may be combined with fever and pain reducers, expectorants, cough suppressants, and decongestants for enhanced efficacy. Consult your doctor for advice on the best usage of medications for optimal results. Avoid giving chlorpheniramine products intended for adults to children, and ensure the dosage matches the child's age as indicated in the table. Over-the-counter cough and cold combination products containing chlorpheniramine may pose serious risks to young children, including death. Chlorpheniramine dosage. Proper dosing of chlorpheniramine is essential for achieving optimal therapeutic effects while minimizing potential side effects. The dosage varies depending on age, formulation, and specific condition being treated. Typical dosage instructions. For adults and children 12 years and older. Regular tablets/syrup, 4 mg orally every 4 to 6 hours, not exceeding 24 mg per day. Extended release tablets, 8 mg orally every 8 to 12 hours or 12 mg every 12 hours. Extended release capsules, 12 mg orally once daily. For children 6 to 11 years. Regular tablets/syrup, 2 mg orally every 4 to 6 hours, not exceeding 12 mg per day. Extended release formulations are typically not recommended. For children 2 to 5 years. Liquid formulation, 1 mg, 2.5 ml, every 4 to 6 hours, not exceeding 6 mg per day. For elderly patients. Reduced dose of 4 mg once daily or every 12 hours is recommended. Extended release, 8 mg at bedtime. Use with caution due to increased risk of anticholinergic effects. What should I do if I miss a dose of chlorpheniramine? If you miss a dose, take it as soon as you remember. However, if it's almost time for your next scheduled dose, skip the missed dose and continue with your regular dosing schedule. Do not double up on doses to make up for a missed one. What happens if an overdose occurs? Overdose symptoms may include extreme drowsiness, confusion, weakness, ringing in the ears, dilated pupils, flushed face, seizures, in severe cases. In case of suspected overdose, seek emergency medical attention. What are the side effects of chlorpheniramine? While chlorpheniramine is generally well tolerated, it can cause various side effects ranging from mild to severe. Understanding these potential effects helps users manage their expectations and seek medical attention when necessary. Some of the common side effects of chlorpheniramine are drowsiness, dry mouth, nose and throat, nausea, vomiting, loss of appetite, constipation, headache, increased chest congestion. Some of the serious side effects of chlorpheniramine are vision problems, difficulty urinating. If you experience serious symptoms, contact your doctor promptly. If you have any adverse reactions to chlorpheniramine, avoid using it. In most cases, the benefits of this medication outweigh the side effects, and serious side effects are uncommon. However, seek medical assistance immediately if you experience any severe side effects. Precautions while taking chlorpheniramine. Taking certain precautions can help ensure the safe and effective use of chlorpheniramine. Always discuss your full medical history and current medications with your doctor before starting this treatment. Before you begin, inform your doctor if you have any known allergies to chlorpheniramine maleate or any inactive ingredients in the tablet or syrup. Mention all prescription and non-prescription medicines, vitamins, nutritional supplements, and herbal products you are taking, as some may interact with chlorpheniramine. Who should avoid chlorpheniramine? Individuals allergic to chlorpheniramine maleate or any tablet/syrup components. Patients with severe liver disease. Those with closed-angle glaucoma. Children under 6 years of age, unless specifically directed by a physician. Anyone currently taking monoamine oxidase, MAO, inhibitors. Conditions requiring caution. Use chlorpheniramine only under medical supervision if you have asthma, emphysema, chronic bronchitis, or other respiratory diseases. Glaucoma, narrow angle or open angle. Peptic ulcers or other gastrointestinal disorders. Enlarged prostate or difficulty urinating. Hypertension, heart disease, or thyroid disorders. Diabetes. Kidney disease. Age-related considerations. Not recommended for children under 6 years without physician direction. Extended release formulations generally should not be used in children under 12 years. Elderly patients should receive reduced doses due to increased sensitivity to anticholinergic side effects, e.g., confusion, dry mouth, constipation. Pregnancy and breastfeeding. Use chlorpheniramine with caution during pregnancy if the benefits outweigh the risks. Animal studies show risk and no human studies are available, or no animal or human studies were conducted. The excretion of chlorpheniramine in milk is unknown. Alcohol and food interactions. Avoid alcohol consumption while taking chlorpheniramine, as it may exacerbate drowsiness and dizziness. There are no significant food interactions, but taking the medication with food can help minimize stomach upset. Always follow your healthcare provider's instructions and report any unusual symptoms or concerns promptly. If you experience severe side effects or allergic reactions, seek medical attention immediately. Possible interactions with other medications. Chlorpheniramine can interact with various medications, potentially altering their effectiveness or increasing the risk of side effects. Understanding these interactions is crucial for safe medication use. Common drug interactions. Chlorpheniramine may interact with MAO inhibitors, isocarboxazid, phenelzine, phenylcypromine. Other antihistamines. Sedatives or tranquilizers. Barbiturates. Opioid pain medications. Muscle relaxants. Sleep medications. Anxiety medications. Some antidepressants. Medications for Parkinson's disease. Medications for mental/mood disorders. Interactions with supplements and herbal products. Alcohol-containing herbal preparations. Sedative herbs, valerian, kava, chamomile. Street John's wort may affect metabolism. Supplements with anticholinergic properties. Always maintain a complete list of all medications, supplements, and herbal products you're taking, and share this information with your healthcare providers to avoid potential interactions. How should chlorpheniramine be stored? Proper storage of chlorpheniramine helps maintain its effectiveness and prevents accidental ingestion. Following these guidelines ensures the medication remains safe to use throughout its shelf life. Recommended storage temperature. Store chlorpheniramine at room temperature between 68 degrees Fahrenheit and 77 degrees Fahrenheit, 20 degrees Celsius and 25 degrees Celsius. Brief exposure to temperatures between 59 degrees Fahrenheit and 86 degrees Fahrenheit, 15 degrees Celsius and 30 degrees Celsius, is acceptable during transport. Storage guidelines. Keep in a tightly closed container. Store in a cool, dry place away from heat, moisture, and direct light. Keep away from freezing temperatures. Store out of reach of children and pets. Do not store in bathroom medicine cabinets, which may be humid. What happens if chlorpheniramine is not stored properly? Improper storage can lead to reduced effectiveness of the medication, accelerated degradation of the active ingredient, potential growth of harmful microorganisms in liquid formulations, changes in consistency, color, or taste, possible formation of harmful byproducts. Dispose of any unused or expired medication properly according to local guidelines or pharmacy recommendations.